So typically patients show up in our triage area where they are triaged, and then unfortunately oftentimes have to spend relatively prolonged periods of time in the waiting room. And unfortunately children up until about 6 months ago were thrown in that mix with the general population.
It's a lot less traumatic than being in adult ER because you never know what's going to be in the room next to you, what they're going to be hearing. And back here, it's just a little bit more kid-friendly.
So we spent probably 12 to 18 months really just looking at the numbers and the metrics of the emergency department overall and trying to identify when was the common time that children arrived in the emergency department so that we could then tailor the resources towards that patient population.
We are in a small space here. There's only five beds and 1 nurse station, so all of us sit there and we're constantly communicating about what's our plan of care with the kiddos.
What we've done differently than other organizations is we've developed this unit within the scope of the entire department. We've made it so it's a seamless part of the emergency department as opposed to a separate unit.
Having that parent look you in the eyes and say, I am so glad you guys have this pediatric area back here. We've been here before and it was so scary. Just the relief in their eyes and the difference you see in the child from when they first came in, it's huge, and that's a big goal.